Hey guys, this is John, and this is my video on frozen shoulder syndrome. So what is frozen shoulder syndrome? It's when the connective tissues, which are right here, supporting the GH joint stiffen, causing pain and reduced movement in the shoulder. So these ligaments and tendons right here tighten up, and it causes the joint to not be able to move as much, which can cause a lot of pain when you try to move your shoulder, and it can make it so you can move your shoulder a lot less. So the causes and risk factors of frozen shoulder syndrome, sometimes it's not really known what causes it, but the most common cause is when your shoulder is immobilized for an extended period of time. So this can be caused by an injury that you've had to your shoulder where you're not allowed to move it, like as prescribed by your doctor, casts on your arm where you're not allowed to move your arm, and also surgeries on your shoulder where your shoulder is restricted for a long period of time. It can also be caused by certain diseases such as Parkinson's disease, tuberculosis, and diabetes. And some predispositions can also occur. So for age, the age is 40 plus, and you are more likely to get frozen shoulder syndrome if you are a female. So the signs and symptoms of frozen shoulder syndrome. Some of the symptoms are it hurts when you move your shoulder. It's really stiff, so you can't move it as much, and limited motion where you're not allowed to move it as much. And some of the signs that doctors are going to be able to see is if when you're moving your shoulder, you can't move it as much, or you're obviously in pain when you're moving your shoulder. So for treatment and prevention of frozen shoulder syndrome, it can last for a lot of months, and there isn't really any way to treat it other than just keep moving it until it gets better. And for prevention, diseases and predisposition to the disease, you can't really prevent that. But if you have your shoulder in a cast or you had a surgery, you should talk to your doctor because they can prescribe stretches that you can do to keep your shoulder movement happening when you're injured. Yeah, so that was my video. Thanks for watching. No shoulders were frozen in the creation of this video. And yeah.